I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
Welcome to this episode of IDD Health Matters. Today, our guest is Joe MacBeth. He is the president and CEO of the National Alliance for Direct Support Professionals. Welcome, Joe.
Thanks, Greg. Good to be here.
Yeah. So, Joe, that's quite a responsibility you have. First, tell us what the NADSP is, what it's about, and some of the things that you do in the organization.
So the National Alliance for Direct Support Professionals was founded in the mid-1990s by somebody that everybody knows, John F. Kennedy Jr. And John was the chair of President Clinton's President's Committee for People with Intellectual Disabilities. Each year, that committee submits a report, or each term, that committee submits a report to the president. And the report could be on any issue that is relevant to people with disabilities at that given time. Well, in 1996, the issue was the workforce crisis.
Has that changed a lot since then?
Well, that's the thing. I happen to be on the President's Committee now, and we're about to submit another report that focuses heavily on the workforce issue, which is why you will never hear me talk about it being a workforce crisis, because a crisis doesn't last 30 years.
Right.
A crisis is sudden and unexpected and temporary. This is a systemic failure by government and funders to address something that is relatively easy to address. And the NADSP, in that original report in 1996, John Kennedy Jr. identified the need to create a national organization to advocate on behalf of the direct support workforce. Of course, John passed in 1999, and we were housed at the University of Minnesota until 2010, when they hired me as his first employee. And at that point, we didn't have a strategic plan. We didn't have a business plan. We didn't have a budget. We had, and this is not an exaggeration, we had $50,000 in the bank, and they kind of banked on it with hiring me as a part-time director in 2011. And I'm happy to say that we've seen moderate success and reasonable growth over the last 12 years.
I certainly echo that. I've seen growth and success as well. And we're actually coming to you from the NADSP annual conference here in Pittsburgh, Pennsylvania, today. So what's the big message about that happening at the conference?
Well, it's an exercise in trying to bring, after 4 years of a pandemic, and you know, Craig, as well as anybody, I think DSPs have been focused throughout the pandemic on protecting people with disabilities from a virus that could kill you.
Yes,
so
very
focusing
much.
heavily on health and wellness. Those early days of March, April of 2020, understanding what personal protective equipment to use, how can we get personal protective equipment, social distancing, helping people with disabilities understand the changes in their daily schedule, all of those things that nobody was prepared worldwide. But supporting people with intellectual disabilities required this workforce to redefine and reimagine how they do their work in 1 day's notice. All of a sudden, and I often talk about direct support professionals, their office is in the community. That's their office. Whether you're supporting people at home, at work, at play, a direct support professional is working in the community. In late March 2020, the office closed, and DSPs were working in houses or homes where there was no access to the community.
There was a lot of fear during that time among everyone. Every person in the world experienced fear. And for direct support professionals, the challenges were immense. I mean, you know, so many people that rely on direct support professionals really need their support for daily living. Yeah. And if that direct support professional doesn't show up for work, maybe, the person who's being supported can face a lot of significant challenges related to activities of daily living all the way to health and wellness.
Yeah.
And there were some challenges with people working, not knowing what to do when they went to work, how to protect themselves, how to protect the people that they were working with. And I heard lots of stories of simply not having enough staff available, not having enough support available. People that were working sometimes had to stay for days in the same place because they really couldn't leave that person alone. I mean, those were really challenging times for direct support professionals.
They were, and early on, I mean, we could have written that script. The thing about direct support professionals is they will rise to the occasion. And you often saw that during natural disasters, hurricanes, floods, wildfires. DSPs are there. They're committed to helping people to be safe and healthy. One of the things that was really concerning to me, you had mentioned that DSPs would basically move in to the residential setting because it was safer than going home and being exposed and all of that. Boy, what dark times those were, weren't they?
Yes, I hate to even think about it.
But one of the things that was, and it was working with the folks from AAMD, is when a person with a disability was admitted to the hospital.
That was a big challenge.
It was, right? And there was no visitors. And what we know historically, when people with disabilities who receive direct supports, often the direct support professionals would provide supports with them in the hospital. Well, during COVID, that wasn't allowed.
And could have anyone there with them.
Exactly. So I think through advocacy, I know the American Academy on
Developmental Medicine and Dentistry, put out a statement on that.
Led that. And we were able to allow direct support professionals to do their work. And it was a win-win, right? It helped the person, the patient. It helped the hospital staff. But it also created potentially an unsafe environment for a worker, for a direct support professional. Right. But it worked out. And but we knew that DSPs would be under the microscope throughout this pandemic. We knew that they would. And I think some of the bigger challenges were, getting access to that PPE, and making sure that they had the resources to keep people safe. When we started community-based living after the closure of institutions in the early 70s, we said that, DSPs would be able to, we would be able to do this cheaper and better quality, see better quality results. And direct support professionals would be part of a community living model rather than a medical model, right? The medical model, people with disabilities are not sick.
Right.
People with disabilities don't need a physician to manage their plan of care. So we kind of railed against the medical model and said the community living model is better. But guess what? During a worldwide pandemic, direct support professionals are healthcare workers.
Direct support professionals wear a lot of hats.
They do.
It's incredible the amount of responsibility that direct support professionals have. And unfortunately, I don't think they're compensated anywhere near where they need to be for the level of quality and of work that they provide.
And that has been for 40 years. It has been the issue. I would venture to guess that if you interviewed 100 direct support professionals and asked them, what is the biggest barrier to working as a DSP? What is the biggest challenge as working for a direct support professional? 99 out of those 100 would say wages.
Yeah.
And they wouldn't be wrong. Wages are not commensurate to the skills that are required to be an effective direct support professional across the board, across this country. But there's more to it than wages.
Sure.
There's workplace culture. There's supervision and the quality of your supervisors, the ability to use your own decision-making and judgment that empowers a direct support professional to take risks and to help people make their own decisions. There's a lot to it, but wages. It always comes down to wages.
So speaking of empowering direct support professionals, the NADSP has a program called the eBadge Academy that focuses on training and developing skills for people with disabilities. Do you want to talk about that just a little?
I could talk about the eBadge Academy for days, Craig. So the eBadge Academy is, we go back to our roots in 1996 when John Kennedy's committee wrote that quality is defined at the point of interaction. Quality happens at the point of interaction between a person with a disability and the staff member. And what does that mean? So before we even created this eBadge Academy, we wanted to dissect that statement, that quote, and what is quality in supporting people with disabilities? What is quality? Every industry has a benchmark for quality, whether it be banking or manufacturing or construction. There is measures for quality. We determined that the benchmark for quality in supporting people with IDD is, how do we help them achieve outcomes? How do we help them achieve things that are important to them? Big things like buying their own home, getting and keeping a job, small things, balancing a checkbook, cooking a meal. Those are outcomes. And when you deconstruct those outcomes, you will find direct support professionals applying their skills. Outcomes don't happen by magic. Outcomes happen because as a result of high intention and skillful execution from a direct support professional. So we built this eBadge Academy around quality, and the quality is knowledge, which is the training that DSPs get. Is it competency-based? Is it contemporary? Is it person-focused? And then the second piece is skills. Taking that knowledge, the textbook of being a direct support professional, and applying it on the job. Taking that knowledge and applying it on the job. And those are skills. And then the third piece is values. Now, every profession, as a physician, every profession has a code of ethics, right? Ours is established by the NADSP. So we ask the DSP, after you tell us what you did to help somebody achieve that outcome, how did you reflect on it? What could you have done differently? Who else could you have included? What will you do different next time? Knowledge, skills, values, quality.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escude, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
I love that, and I've had the pleasure and the opportunity to be able to work with some of the staff to create a specific health related badge, which is really pretty cool. Yeah. So it's exciting to be able to be part of that in a very small way, but it's a great way to really provide training, education, but recognition for the tremendous work and skill sets that direct support professionals have.
Well, and what we tell direct support professionals is, you're already doing this.
Yeah.
Show us what you're doing, and we can codify it. Every badge testimonial that receives a badge that is approved is a piece of quality. And we have tens of thousands of points of quality that we can write a book about that DSPs are doing every day in every community in this country. We just want them to show people what they're doing. And that is all about recognition.
So great stuff about NADSP. I want to hear about Joe. Joe, how did you get into this field?
Like most people, I started as a direct support professional. And
that's an exceedingly common story. And so many people that I talk with who now do such a huge variety of things in this field, many of them started as a direct support professional.
I think there's kind of a badge of honor that goes along with that. It gives you credibility.
I agree completely.
Like most people also, I mean, I kind of happened upon it accidentally. Just out of college, had a degree in psychology, which doesn't really lead you to a whole lot of job opportunities. So I was looking for a job, and I was looking in the newspaper. That's what you did in 1983.
Yep.
40 years ago. And I circled this job that was looking to hire a resident instructor. And of course, I had no idea what a resident instructor was. And I went down and filled out the application, and they hired me on the spot. No criminal background checks. Nothing like that. They said, here you go, come to orientation, tomorrow, and we'll get you into working in a group home by the weekend. And sure enough, they did. And I remember my first day on the job. And here's the other thing about direct support work. You never forget your first day on the job. I remember it like it was yesterday. And this was in 1983. And I remember walking up the stairs into that group home where I was just woefully unprepared and nervous and second guessing my decision to accept this job. And then I walked in and I was welcomed by these people who I was hired to support. And I'm in the back of my mind, I am putting you at risk. I am not trained or prepared to support you. And a lot of people will leave this job in those first few weeks of employment because they're not prepared. And then those who stay because they kind of figure it out. I figured it out. And I'm sad to say, 40 years later, we are still putting new direct support professionals in dangerous situations because they're not prepared.
That leads to training. And the story that you told, I can completely relate to as a physician. The first time I set foot in a program supporting people with intellectual and developmental disabilities where I was responsible for healthcare.
Yeah.
And very quickly realized I was not trained to meet the healthcare needs of people with IDD. And as you know, that's kind of my big focus.
Oh, I remember you telling me
is to provide training and education to the healthcare world and really the supporter world in general, to help them recognize health conditions that are often missed, that we just don't think about because they present so differently sometimes in people with IDD, and then to know what to do when you see these signs. And that's what I kind of live for now. But that is so important. And going back to training and training, really any job. I mean, we need to be prepared to do jobs that we do. And there's a training component, there's a training aspect that helps prepare people for certain jobs, and training on lots of different things. And again, my focus is health and wellness. So I always like to see a little bit of health and wellness training for direct support professionals as well. But what are some of the other areas of training that you think are important that need to be focused on when someone's starting in this field?
Well, training is an area where we are highly critical of this system. Every state has training requirements before you can work with people with disabilities. There are state required trainings. And when you look at those state required trainings, we are mandated to train DSPs for the worst day they will ever have on the job. What are required? First aid CPR.
I haven't thought about it that way.
Oh, yeah.
That actually makes sense.
First aid CPR, fire safety, bloodborne pathogens. If you have to deal with blood, if you have to deal with a fire, personal interventions, if you're helping somebody who's having a bad day with challenging behaviors, you're trained for that. We're training people for the very worst day possible, and that's required. What we're not required to do is every other day, help supporting people find and keep friendships and relationships, helping people be contributing members of their communities, helping people understand inclusion. Those are those values-based things that DSPs do every day, and there is very little training around that. And when you take a look at, we talk a lot about competency-based training, and competency-based training these competencies were delivered through research, and there's science behind it. And the badges have connections directly to those competency areas. So we want to see competency-based training, and that's not mandated by any state in this country. I think we're starting to see some improvements. I think employers are certainly understanding the value of competency-based training. But, before I go on, I don't want to minimize fire safety.
Right. They're certainly important.
They are important. And you need to have training on it, but I would argue that you don't need bloodborne pathogen training every year.
Yeah.
So anyways, training is a big piece. And even we talk about ongoing professional development. You're a physician. Physicians have practices, right? You have a practice.
And a requirement for ongoing professional development. Yeah.
And we talk about attorneys and physicians, they have a practice because you're ongoing, continuous practice of your skills. You're never a master. You're continuing to learn and grow and develop as a professional. We need to change the way direct support professionals are perceived as these entry-level caregivers or carers to a professional that requires certain level skill standards.
Yep. Definitely.
Yeah.
So one of the purposes of this podcast, and really, I'm doing this in conjunction with an organization, a provider organization out of Ohio called Friends for Life, and their primary purpose in starting podcasts around these topics is to help people, in particular direct support professionals, help people understand this field better and see it as a viable career opportunity. So one of the things that I typically do is something I call kind of 3 in 3, 3 things in 3 minutes. I ask guests to tell me 3 things in 3 minutes related to anything that could improve health and wellness and supports and services for people with IDD. But what I'm going to ask you is 3 reasons why people should consider working in the direct support field.
3 reasons why people should consider. One is, I think it provides you with a very good opportunity to understand humanity. We are all interdependent. We support each other. And I think that if you want to understand the human condition and people who have historically been marginalized and segregated and abused, this is an opportunity to do social justice work. It is social justice work. People with IDD have not always been able to exercise their human rights, their civil rights, able to vote. And this is a way to reach younger professionals to do work around social justice. That's the first one. The second one is you learn a lot about yourself. You learn a lot. I mean, we are learning from each other. When I was a direct support professional, I would not have stayed in that job if the folks that I supported didn't help me understand about their past, their life, their culture, how they celebrated holidays, being culturally competent and understanding this rich and vast multicultural society. Direct support work you're immersed in that. That's the second one. The third one is, I think it's a great opportunity for growth, professional growth. Yes, you can stay as a direct support professional. One of the reasons why we created the eBadge Academy is when you achieve those 3 levels, you should also achieve increases in your salary to keep those people in those jobs that they do really, really well. But I also think that it's a great opportunity for you to be exposed to nonprofit sector work and grow your career as a professional.
And I've seen people who started off as direct support professionals that when they retired in the position of executive director of a state developmental disability agency.
Absolutely.
Or a head of some other big organization, and their roots were started as a direct support professional.
It's a job that will prepare you for almost anything.
Yes, absolutely.
It prepares you for parenthood. It prepares you to negotiate contracts. It prepares you for everything. It's helping. You're walking side by side people along their particular life journey. And nothing, in my opinion, is more fulfilling than that.
Yeah, if you want to feel like you make a difference in this world and make a difference in other people's lives, this is a great place to do it.
Absolutely.
Yeah. Joe, this has been great. I know we have a lot more to talk about.
We could talk all day.
Maybe we can talk another time again, but I really thank you for taking the time out of the conference to come and talk with us today. And more importantly, I thank you for the incredible work that you do in the field.
Well, thank you, Craig. Thanks for the opportunity. Thank you.
All right.